So measles is another respiratory viral infection, which is as well known as a kid's disease. And measles belong to another type of viruses. It is negative sense single-stranded RNA in the contrast with Toga viruses, which are positive sense. And it belongs to another family as well, Paramyxoviridae. And measles, actually, current name is measles morbidivirus because it belongs to genus of morbidiviruses. So viruses enveloped and about 20 different genotypes are described. Again, different authors and different scientists count different number of genotypes, but actually in medical practice it's not really important because any genotype carries the same serotype. So antigenic structure of virus is identical in all genotypes, and actually again it's easier for us because the only serotype requires the only type of immune response, and similar to rubella, measles usually is possible only once in a lifetime because common type of it. And disease is transmitted only human-to-human contact. And in the case of measles, the disease is more important and more significant. It is more dangerous with more severe duration. One infected person will infect about 20% of surrounding people who are not immune during that incubation period or first stages of the disease. And it's making that virus more prevalent, and a lot of kids and kids collective will be infected with that measles. Actually, we had a small epidemic of measles even in students collective in 2019, when the whole hostel was closed on the quarantine because of massive spread of disease in student groups. And actually, again, it is a common problem for multiple diseases, and measles is not an exception. When parents or adult people, they hear something, the vaccine is a life and continuing life viruses, especially if it is MMRV, then 4 live viruses are present in one vaccine, and they have incorrect knowledges. They hear something in mass media, and they think that that vaccine is extremely dangerous, that it can give a disease for kids, it can kill them, and they all refuse to perform vaccination in their kids. And nowadays, we have a kind of layer of people who are not immune against even measles because in kids' age parents didn't perform vaccination. So, of course, and nowadays vaccines are much more safe than in previous decades. And previous decades, everyone was vaccinated. We had no problem with that thing. So that reason is one of the reasons why we still have a massive mortality rate and a lot of kids that are registered, especially in young kids population, because of that very old and very good known infectious disease caused by, again, very old known virus. So according to official data in 2016, about almost 100,000 deaths in kids were registered due to measles. And still, we have some small epidemics of the disease, but they, of course, not so massive and prevalent as in previous years. And actually, before massive vaccination was introduced in multiple countries, every 2 to 3 years we had that massive epidemics with extremely high mortality rate, and actually about 2.5 million of kids died every year due to that infection. And nowadays, of course, mortality rate is much lower, but still it remains quite high in the modern medical era, when actually it's very easy and extremely easy to prevent the disease and to prevent that mortality rate if you will provide correct medical information for people about those vaccines and profit of the vaccines. So the same manner infection is transmitted only from one ill person to other people, and the same main symptom is a rash which will appear even before acute onset of symptoms, and usually again virus transmitted through respiratory ways, and initial entry gate is mucous layer of respiratory epithelium and local multiplication in cervical lymph nodes. So incubation period can last from 1 to 3 weeks, and usually disease will start with prodrome phase when non-specific symptoms of respiratory infection will appear. But of course, uh, no one will understand that it is measles already because it's a non-specific symptomatics with some sneezing, coughing, running nose, fever, and maybe if doctor or parents will take a look, will check respiratory epithelium, or they will check mucous layer of oral cavity, they will identify that unique lesion which is known as a complex spots. It is a small bluish or white uh, elements in the mucous membrane of buccal area. As you can see on that picture, it is easy identifiable. It is looking like small ulceration, and usually it is appeared opposite the lower molar teeth in both sides. It is bilateral lashes, but those elements will appear before rashes on the skin, and usually it will be missed by doctors and missed by parents, and they will gone in a day or few days. So if you will perform a histological study of this element, they contain giant cell and antigens of measles virus. So the main element of measles, it is rashes which will appear in eruptive phase. Usually it lasts for a week, and the same descendant symptomatics. It will start on the head and spread on the trunk, extremities, and will cover the whole body. So in case of measles, elements are dark, even brownish in color. They can emerge, form blotches, and usually it will resolve by fading with discoloration of epithelium. But after complete convalescence, skin will become clear and nothing will remain on epithelium, no scars, no decolorization, nothing. And it will be gone completely. Uh, Complications again are rare, and usually they are very mild and observed in elder kids. It can be otitis or pneumonia, usually when bacterial infection will complicate the disease. And in histological studies, it is the same as in the complex spot, formation of giant cells containing virus. And actually, pneumonia is the main reason of lethal outcomes, and people, and especially kids, dying because of that complication. In elder population, disease can be complicated by acute encephalitis and actually multiple disorders of central neural system, and they are not always deadly, but they can lead to serious consequences because they can cause different types of mental discrepancies. And similar to rubella, measles is extremely dangerous during pregnancy because it is leading to miscarriage, stillbirth, premature birth delivery, and can cause serious complication in kid if it will be delivered and if woman became infected in last trimester of pregnancy. So because of significant lower immunity and because of high virulence properties of virus, infection confers lifelong immunity. And again, measles is almost always observed only once in a life. Single serotype and very serious virus will provide life-lasting immunity. Diagnosis is the same, usually clinical presentations, that unique rashes complex sports and history of recent contact with ill people is the key to put the diagnosis. If you need to confirm, we have the same ELISA test, and we have immunofluorescence as the main method to identify virus in human respiratory epithelium or other tissues. And prevention is, again, it is a common for number of respiratory diseases, isolation of ill person, identification of contact people if it is required, and quarantine. The whole kindergarten, hostel, or school should be closed completely, no contacts with those people. In moderate to severe duration, of course, or if you will suspect that some complication is going on, then of course those kids should be isolated in infectious department and should be provided with correct medical help. And we have vaccination as the main measure. The same MMR, and MMRV vaccines, we will talk later, can be provided for those kids. So it was noticed, and actually nowadays it is confirmed, that vitamin A deficiency is one of the risk factors of measles in general and severe duration of the disease especially. And in nowadays, prevention of vitamin A deficiency is one of the measures to prevent infection in those kids who was not vaccinated as minimum. And vitamin A can be given for those kids who are already ill to decrease mortality and severity of infection. Few articles are available, and actually some data in mass media about ribavirin efficacy, but actually it was not confirmed in any clinical trial, and it is only some observations and notice by doctors and some medical professionals, but actually we have no correct and strong data to confirm that it is really so. But of course, if you have that vitamin preparation, you can provide it. It will not make worse as a minimum, and maybe it will give some good effect for affected kid.